Do you have a curve in your penis? What is it? Why did it happen? And can you cure it? It's called Peyronie's disease and it might be causing you trouble in your sex life. And you might have tried some crazy things to cure yourself. But in this video, I'm going to tell you the truth. What it is, why it happens, and how you can cure it. So get ready as this psychologist who specializes in clinical psychology tells you the cure of the curved penis. Ladies and gentlemen, and boys and girls of legal ages, this is Pro Sex Tips. So before telling you about the cure, I want to tell you about what it is and why it actually happens. So the first thing about Peyronie's disease, it's not really a disease. It's a disorder where scar tissue called plaque develops inside the penis. So the plaque buildup occurs in a thick elastic membrane called the tunica albuginea. And the most common area for the plaque is the top or the bottom of the penis. Now this can cause painful erections, painful intercourse, or might even make intercourse impossible. While the exact cause for Peyronie's is unknown, scientists have discovered that injury to the penis and autoimmune disease are the two primary causes. Injury typically occurs during hitting or bending during sex, athletic activity, or even an accident. This causes the rupture of blood vessels, and this causes bleeding and swelling inside the layers of the tunica. When blood flow can't normalize, clots form and trap the immune system cells. Now, as the injury heals, the immune system may release substances that lead to the formation of too much scar tissue, which eventually forms the plaque. The plaque reduces flexibility of the penis, leading to curvature, and finally hardens due to calcification. Now, Peyronie's is also viewed as an autoimmune disease by some experts. In such cases, it's often inflammation that leads to scarring. This usually occurs when the connective tissue that supports and joins different parts of the body get damaged, leading to the curve in your penis. This usually affects about 20% of men and they're about 40 to 70 years of age. But that number might be more because people rarely report it out of fear of embarrassment. Now, this is rarer in younger men, but your chances of getting Peyronie's increases as you age. And now it's time for the million-dollar question. How do you cure it? Well, an intervention is not usually advised unless somebody has a bend of 60 degrees or more. And despite this, men with a bend of say 40 degrees tend to perform really well. But if you are facing any of these problems, I suggest you see a doctor as soon as possible. Now, there are two primary modes for treatment of Peyronie's: non-surgical and surgical. Under non-surgical methods, we first have medications. And these are designed to reduce plaque size, inflammation, and decrease curvature. And this can be introduced in the form of tablets or injections. New medical therapies have also been developed to treat Peyronie's, and these include focused ultrasounds on the plaque, X-rays, shockwave therapy by using acoustic waves, and lastly ionophoresis and vacuum devices to reduce curvature. Now, if this doesn't work, the plaque is reduced or the penis is straightened through surgical means. And more often than not, this is a permanent cure for Peyronie's. The first type of surgery is called grafting. In this, they cut or remove the plaque and in its place attach a vein, a piece of skin, or maybe some animal material as well. Now, this is aimed at straightening and reducing lost length due to Peyronie's, but people can face numbness and erectile dysfunction following the procedure until the wound heals. The second method is plication. Now, this involves removing or pinching a piece of the tunica from the side of the penis, and this helps straighten the penis. It's important to note that this procedure does not restore length or girth of the penis and may even cause some shortening. And the last procedure done is usually a device implantation, which is a last option. And now you know the truth behind why there's a curve in your penis. So guys, if you have a bend of 40 to 50 degrees, that's still okay, just as long as you and your partner don't have any pain or discomfort during sex. 60 degrees or more, get help. And one final tip, even though a chili might be bent or curved, it can still pack quite some spice. Remember that one. So guys, now I hope you've been well acquainted with Peyronie's and what it actually is, and most importantly how you can treat it. If you found this video interesting and helpful, give me a big old thumbs up. It's right down there. If you have any questions regarding sex or any other problems, let me know down in the comment section below. My message to you is, if you have a problem, sexual or anything else, be sure to seek help. If you still have doubts about Peyronies, be sure to visit a urologist, sexologist, sexual medicine expert, or even a sex therapist, and they'll be able to help you out and clear your doubts. And be sure to subscribe to my channel to learn more pro sex tips and improve your sex life. This is Vikram signing off, and I'll see you in the next session.